Hi, my name is Ray Peachey. I am the Substance Abuse Prevention Coordinator for the town of Westford. I work with the Health Department, and this is Health Beat. So we're going to talk today to the Westford Public Town Nurse. And this here is Gail Johnson, and she will explain what she does, and some very interesting information. Gail?
Thank you. I have been a nurse for 26 years. And the last 4 of those years, I have been a public health nurse at the Westford Health Department. And a lot of the duties that I do and perform, we're going to discuss a little bit, a condensed version of what it is that I do as a public health nurse.
Yes.
One of the things that I do is the investigation of communicable diseases. So before I actually get started on what that means, what that requires, what I would like to discuss is, how do I know? How do I know you have a communicable disease? So I'm going to do a little scenario. You are sick, you go to a doctor, the doctor says, let's go run some labs. That could be a blood test, a urine, that could be stool specimen, that could be sputum. That goes to the lab. The lab, by law, is required to report up to 97 communicable diseases to the state. And the epidemiologists get the results. Now, there are 351 cities and towns in Massachusetts. The epidemiologists cannot call every single town. They just can't. So they ask the public health nurses to do investigation work. And that is what we do. We provide the investigation. That requires calling the patient, or they call it cases because they're really not my patient. Or it requires calling the doctor's office, speaking with the nurse, speaking with the medical assistant, and getting information about you. Because a lot of people I call, the residents don't know why I'm calling, and how do I know? How do I know I don't work at your doctor's office, so why is it that I am privy to this information? So I am privy because when I work on a database, generally, so when I find this out, I have to do an entire investigation. So I'll call you and I would say, Ray, you've got these symptoms, explain who I am, how I got to know this information, and I would proceed with a very detailed investigation on communicable diseases with you.
Okay.
In addition to that, although tick-borne diseases are not communicable, but the state follows communicable diseases.
Okay.
They want to know that you have Lyme disease and where is that located, and they want to know this so that they can write statistics up and get information. Unfortunately, with ticks can not just carry Lyme disease. You can get dual diseases. You can get anaplasmosis, babesiosis, ehrlichiosis, Rocky Spotted Mountain fever. I mean, these are all these off of one tick. They can have dual diagnosis. So how do you know you have it? Some people don't even know that they have a tick on them. I mean, it's easy if you found you had a tick on you, then it's really easy to be like, oh, I found a tick on me, a few days ago, and that's why I'm sick. But what you typically find is people say, I have no idea, I never even saw a tick on me. They bite, they fall off, and now you are sick. You get all these flu symptoms, the fever, you get the aches, the body aches, joint aches and pains, muscle aches and pains, you might get nauseous, you got a headache. All these symptoms that you're like, that's odd that I'm sick right now. And you go to the doctor and they run a whole tick panel on you to determine whether or not it's a tick-borne disease. So sometimes you might get Lyme disease and anaplasmosis, or babesiosis, or ehrlichiosis, whatever.
Yeah.
So the state, again, as I said, they're not communicable. I can't catch it from you if you had it, but we want to track it, and that's really very important for the state to figure out where is all these tick-borne diseases coming from.
See if they can maybe prevent it of some sort.
or treat the area, or however, exactly.
Right.
So that's really very important. Babesiosis is one of those that not only can you get it from a tick, but you can also get it from a blood transfusion. That's one
The
of
other person already had it.
So the donor that you're getting it from may have already been been diagnosed with babesiosis, not necessarily sick with it, and now you have it. So those are that's just one additional question besides where did you pick it up? Did you travel? Did you move out of the state or the country, or did you get it in the backyard?
Now, I know I just heard when it comes to diseases that the Department of Public Health just upgraded their West Nile virus up from what is it, from a low risk to a medium risk, and it hasn't been done that often.
So moderate risk, just generally speaking, it's giving us more of an alert to be more aware of ticks and how to prevent getting bit. Now, you can't really prevent, completely, but you certainly want to do things. For instance, using the DEET, spraying your body with the DEET, having clothing that's sprayed with that as well. You want to make sure that there's no standing water in your backyard. Anywhere there's like a bird bath, you just want to get rid of all of the standing water. Those tires that are in your yard that are filled with water, dump it out, get rid of it. You want to just limit the outdoor activities, or make sure you're wearing the spray,
clothes,
the clothes and the DEET. Very, very important that you would want to do that. And but yes, because they're testing the mosquitoes now, and they're finding that they're becoming positive. There are no cases, however, right now of humans.
Yep.
As of right now. Another very important thing that a public health nurse does is tuberculosis. Now, tuberculosis is a respiratory disease. It's droplets. You cough, but it has to be for a long time. I mean, you just don't walk and get it.
I know.
It's long time exposure of someone that's coughing and ill. You get the fever, the night sweats, again with the muscle aches, and you're just feeling awful. And when you have all these symptoms, again, you go to the doctor, they isolate you, and they will diagnose you with tuberculosis. Once you've been diagnosed with tuberculosis, however, the public health nurse is responsible for doing what's called a DOT, a direct observation therapy. Basically, what that just means is that I have to go to your home, or really anywhere. Like, they can meet me at the health department, or we can meet somewhere, but generally it's their home, and I have to watch them swallow their medication. There are a lot of medications that go with tuberculosis. They take it every day once a day, every day, for 6 months to a year or more. And I have to make sure that they're compliant with taking their medication, because you don't want it to spread.
Correct. I have a question on that.
Yeah.
Let's say somebody is vacationing up here for a week, okay? And they get up here, and all of a sudden, from, let's say, South Carolina or something, where they came from, the nurse finds out, they have tuberculosis. They find out they're coming up here. Can she call you to witness that?
Yes.
Okay.
You get a lot of international travel now.
Yeah.
People are going, you have latent TB, where you have it laying dormant in your body, and then for whatever reason, whether you became sick or your immune system is affected, and all of a sudden it rears its ugly head and out comes the active TB. But you can have latent TB, and again, you need treatment for latent TB. You need to be on the antibiotics for, again, it could be up to 3 months, 6 months. But once it's active, that becomes much more serious, where you need to watch someone witness you taking it for being compliant.
Okay.
So that's really, so communicable diseases are very, very important. And as I said, 97 of them are reportable. Some are immediate, like tuberculosis or anthrax, let's say.
Yeah.
the state doesn't wait for me to get on the database on the
Yeah.
computer. They call me and say, Gail, let's get started on this within 24 hours. I must answer and deal with that, whatever that may be. Even if I'm home on the weekend, if it's an immediate, I
You have to go.
gotta go.
Okay. Now, I know that there's a bunch of programs that you do for the town. So you want to go through some of those with us?
I do a lot of programs.
Yes.
We all try to do a lot of programs at the health department. I coordinate and implement the flu clinics. And that's a huge thing we provide.
Yeah.
I do a lot of flu clinics. And at the end of this presentation, I will name some of the dates and of the flu clinics. It's very important. We want to vaccinate as many people as we can. Last year's wasn't so great, the match, but it's really important. Vaccinate. It's good to have the antibodies build up in your body, and it's important so you can fight. You can fight it off. It doesn't mean once you get vaccinated, you're exempt from ever getting the flu.
Right.
That's not true. You can get the flu, absolutely, but you'd get a milder case.
Yeah.
And so that's one of the programs, is my flu clinics, and also my summer camps. I was very busy this summer. We had a lot of summer camps that I have to make sure, and I share that with the health agent. She'll check her portion of what she has to look at in the camp, but my portion is making sure the immunizations for the campers and staff are all
Up to date.
up to date. Got to make sure they're, and physicals. And I have to make sure they have an infirmary, they have a first aid kit. You always have to make sure if they're on medication that their doctor that they pick for the camp trains them on how to use EpiPens, how to use inhalers,
Okay.
and diabetics as well.
Now, I know one of the ones that I'm interested in is this new shingle vaccine that's out.
Okay, so the Shingrix is what it's called. We used to have the Zostavax. One of the pharmaceutical companies made the Zostavax, and they said, yep, it was one and done. You have your shot, you're good to go for life. That was for 60 and older. Mm-hmm. And then another pharmaceutical company snuck in and said, all right, let's go ahead and make a new one. So they have. It is a 2-part booster. You get your first Shingrix vaccination, and then 2 to 6 months later, you get the other one. So it's 2.
Okay.
But by doing that, it's over 90% effective. So all the people who have already had the Zostavax, and for those 50 and older now,
Right.
it used to be 60 and older,
Yeah.
now it's 50 and
Good.
older, can now all get the Shingrix. So the little caveat about that is we're still waiting upon, well, the health department's still waiting upon being able to have all the insurance companies buy into this and
Correct.
be on board. And I believe that that's coming down the pike a bit, not quite here yet. So as soon as I get the thumbs up that the insurance companies will cover it, then I would be happy to start ordering it and finding out what the needs are of the community so we can buy it. And
I remember the old one was like at around 62% effective compared to
ran-
this 90 or so, right?
It was. And again, 50 to 60% effective, still added antibodies in your system, and it's still good. I mean, it's still very helpful because, again, like the flu shot, it doesn't mean you won't get the shingles. It
Yeah.
just means that if you get it, you'll get a milder case. And so, that's a huge thing. So as soon as we get it, but pharmacies still have it, so, call your insurance companies first to find out if they cover it, and then
Call the pharmacies, make sure they have it in stock before you just go down
right,
there.
because there was a little back order
Yeah.
going on there.
Yeah.
So that's true. But pharmacies, the insurance companies first to find out if they'll cover it, then look around
Right.
to see who will cover it. Doctors' offices, pharmacies, and eventually, hopefully, we'll be able to
Now,
offer it.
the majority of our shots that we give out are not free. They're covered by insurance.
So again, it depends on, right. We try to get the insurance companies so that the insurance companies can pay and give us like some reimbursement back for the town. In order for us to continue doing all these programs and all these vaccinations,
We need to get the money.
we need the money.
Yeah.
I can't purchase a Shingrix vaccination unless we have the money. It's very expensive. So I'll move on. But we have I do blood pressure screenings in the office and at the senior center, cholesterol screenings for the residents. I do that 2 to 3 times a year. And educational programs. We all try to do educational programs in the health department.
Yeah.
We try to do it as often as we can. And also I teach CPR. I've been a CPR instructor for a very long time. Long time. And so we do that for residents and for town employees as well. A new program I've been teaching is Until Help Arrives, and Stop the Bleed. These are 2 very, very important programs, so look out for those. They're emergency preparedness. You're the help until help arrives.
Yeah.
So it's not like you walk around with a paramedic at your side all the time. So if something happens, you need to know how to put on a tourniquet, you need to know how to put a dressing on a wound, and wait until, someone from the emergency personnel can help. So those are some of the programs that I like to offer.
Okay. And you belong to a bunch of committees, I know, right?
I do.
Which, I do too, and they are very helpful. You might be able to explain a couple of them.
Yeah, you and I both.
Yeah.
We are part of a lot of committees, and those are so important because those are the people we want to resource with,
Yeah.
and they're great. So a big one that's, like I said, near and dear to my heart was the Westford Coalition for Nonviolence. It's in regards to domestic violence awareness. And basically, we meet with the committee members. We meet once a month, and we talk about different educational programs to raise awareness for domestic violence. October 26th, which is a Friday, we're going to be doing a Light Up the Night event
Okay.
at the PCA, the Parish Center for the Arts. And hopefully the Westford theater students will be able to be there with some of the soloists from the Westford choir. And again, just raising awareness. So hopefully people will attend this. It's so important. And we are also accepting donations. And those donations go to the Live for Live Foundation and also the Alternative House. So that's very important. And I just want to bring up the purple lights. People have asked, what are the purple lights around town? Why do we wear that? I mean, why do we wear that?
I know
Well,
what
I'm
you
wearing
mean,
purple now. But why do we have purple ribbons?
Yeah.
Why do we light up the town purple? It's just, it indicates that it is Domestic Violence Awareness Month.
Yeah.
So
Very
that's what
good.
the purple lights are for. Also, MRC, the Medical Reserve Corps. I'm part of the Medical Reserve Corps. It's emergency preparedness.
Yep.
And also MHOA, Massachusetts Health Officers Association, Massachusetts Public Health Nursing, and also emergency preparedness for our coalition, which is 7 towns. We're very, very active with that for emergency preparedness.
Now, special needs registry, okay? And this is not unique, but it is something that's very important. Well, maybe you can explain that.
The Westford Special Needs Registry is so important. It helps by letting people know that if you have a cognitive problem, a muscular, any type of developmental problem, any difficulty in you trying to get out of your home, it's really, really important that we have you on a registry. It helps the emergency personnel, EMTs, paramedics, fire. They'd like to know where you are. That doesn't mean if there's a disaster that they're going to come running to your house and scoop you up and off you go. But it's a really good idea to know where you're located. Where are you? Also, why do we need to know? Well, we open up the shelters. We open up shelters in our town. And if we're going to have a shelter, we want to know if you're on oxygen. It would help us place where you are, where you're sitting, where you might be, the cot set up. It's important to know if we need an outlet, if you're a diabetic, if you forgot your insulin. so many
We can
different.
set this up ahead of time.
It's good for us to
save,
know
yes.
because we want to be able to, if you are in need of a big boy cot instead of a regular cot, we need to know this.
Yeah.
Also with pets. We want to know if you have a pet. We want to know if you're going to bring the pet along and how to accommodate you. Lots of different things. And the file of life, I also want to say, is a very, very important thing, is that everyone should pick up a file of life, whether it's at the senior center or at our department. It's so important to have a file of life. That way, if you can't speak, it's so important to have your demographics, your name, your address, phone number, next of kin, your medications has to be up to date. You should check it every 6 months to make sure it's up to date because medications change all the time. So it's really crucial that you have a file of life on your refrigerator.
Okay.
And so to find out this information, the Westford Registry and the file of life information, it's on our website. And it's important that you pick up the, or download it or whatever, get the information, fill it out, send it back to me, and we'll disperse it to the emergency personnel people.
Good, good. Now we got some updates on vaccinations, the dates and times.
So we got a lot of flu clinics coming up this year.
Yeah.
So October 5th is our the Fletcher Library one, and that's
Okay.
from 10 to 12.
Yeah,
This will be on our website. This is going to be out there. So I'm just going to
yeah,
say it now, but we'll have it listed, and people will be able to look it up. October 11th is the Franco. That's for the senior vaccinations for 65 and older. October 16th and the 23rd are both at the Millennium, and that's a 6 to 8 p.m. And I'm also doing a program for the grandparents for a Tdap, which is tetanus with pertussis. Pertussis is whooping cough, and so we want to make sure that the grandparents are medicated with the Tdap vaccination, so that you can prevent
right.
Spreading pertussis to the babies, because it can be very deadly to little babies.
Yeah, definitely.
I'm sorry, that was on November 27th.
Okay.
So I'll have that posted as well.
Yeah. Okay. Good. So any of this stuff being done is posted onto the website, and all right, some fun facts that we have from the CDC.
So I just was on the CDC looking for some kind of fun facts. So I'm actually going to read some of it because some of it's, lengthy. But in the U.S., I just thought I would just add a little stuff. The FDA is the one that makes the final decisions. The Federal Drug Administration, they make the final decision about what's going in your vaccines. And they're the ones that start in February. The FDA, they talk with the CDC, they talk with the Immunization Advisory Committee, so they all sit around in February and they discuss what upcoming viruses around. So what they do is they do surveillance and data collection. So when you do that, you can come up with an idea of what's circulating around.
Okay.
And in order for you to build up the antibodies in your system, it's important to vaccinate. I really can't say enough about that. And also, it stops the germs, right? You want to stop the germs. If you're going to cough, you're going to sneeze, do it in the elbow, use your tissues. It's really, really, really important. And if you're really, really sick, they'll put you on some antiviral medications that will help, like Tamiflu and things like that. Doctors will recommend that you do that. And wash your hands. Wash your hands. Number one, huge thing. And if you don't have a sink, soap and water, then use hand sanitizer.
Yep. Right.
But really, that is one of and stay away from sick people. If you can.
You're sick, stay
home.
Right.
Exactly, Ray. Stay home.
I know.
Don't go to school. Don't make your poor kids go to school and cough and sneeze and have a fever all over the other students, because then everyone's going to get sick.
Good.
Stay home for work.
Okay. Thank you. Very interesting. I hope everybody really enjoyed that. And next week, we're going to have, next month, we're bringing a person in that's going to talk about the opioid crisis that we have around. And hopefully bring some information that everybody can use, because it is here, it is in Westford, it is everywhere. And we just want to make sure that we can do our best to try and stop these overdoses and fatalities. But again, Ray Peachey, and thank you very much for watching TV.